Good evening and welcome to Kini News. Former Prime Minister Dr Mahathir Mohamad has taken a veiled swipe at those who are hesitant to voice their objections to the recent emergency declaration.
Many people think the emergency is not necessary but are afraid of expressing their opinions. This is according to former Prime Minister Dr Mahathir Mohamad. In a post on his blog today, Mahathir said he had spoken to many people and they had cited several reasons on why they thought the emergency was unnecessary. However, they were in fear and only voiced their opinions in harsh tone while looking around. They did not want their opinions to be circulated, he said. He said they are afraid because the government is powerful and can do anything to them. He added that there is also a fine of 5 million ringgit and imprisonment for 10 years without any legal protections. Mahathir said he had tried to make it clear that the government cannot do that, but others were unconvinced and unhappy. When asked to sign a letter of appeal for an emergency to be withdrawn, they refused, he said. While Mahathir did not name the target of his post, it appeared he was addressing MPs who were hesitant to petition the Yang di-Pertuan Agong for special parliamentary sessions to debate the emergency. On Saturday, PKR President Anwar Ibrahim claimed that between 114 and 115 MPs, a majority in the Dewan Rakyat, are against the emergency declarations. Anwar said this is enough to ask the king to consider their appeal for parliament to reconvene and have an emergency aborted.
Now we'll take a look at the nation's latest COVID-19 situation in this segment brought to you by Blue Air.
The Health Ministry reported 3,048 new cases of COVID-19 today, with 8 of them imported. There were 3,638 new recoveries. This brings the total active cases in the country to 41,076 cases. From the local cases, Selangor recorded the highest number of new cases with 1,035. This was followed by Johor with 529 new cases, Sabah with 348, and Kuala Lumpur with 305. 261 patients are in intensive care, with 101 requiring ventilator support. 11 new deaths were also recorded today. The total deaths from COVID-19 in the country has now gone up to 689. The Health Ministry said that it hopes the number of new COVID-19 cases being reported will stabilize in 2 weeks, amidst the number of new infections hitting its lowest point in 11 days.
1 year ago today, Malaysia reported its first COVID-19 cases. We spoke to a doctor to get a better insight on the difficulties they face when they cared for their patients. Before we move on, if you like the content we produce, please check out the link in the description below to make a small donation and help support us in producing quality content.
The unforgettable moments is when we see a COVID patient die because they are not being accompanied by their close relative or families. It's quite a sad moment for me. I still remember one of my patients who was quite elderly. When he came to us, he was quite severe. I say to this patient, Pakcik, saya nak tolong Pakcik, nak tolong selamatkan Pakcik. He replied to me, tak apa, masa saya sudah sampai, saya memang sudah patut mati. That immediately made a shock to my heart lah, because suddenly patient is like accepting his fate that probably he is going to die. He did not manage to make it after that. For COVID-19 patient, there are lots of patients who are quite unstable. Sometimes they need to be put asleep and put on ventilator, on breathing supports. Majority of the patients in our ICU are elderly, but there are also some numbers, small numbers of young patients who are quite severe. For this patient, we do video calls with their families to update. Family support is quite important in recovery of patients from illness. But obviously in COVID, visitors are not allowed. So I think video calls do help in recovery of patients. So total about that time is I think about 23 or 24, something about that. That was by end of November. But suddenly the number increasing quite fast in the middle of December. In one day, we need about suddenly 2 to 3 beds more to cater more patients for every day. So we are quite worried because in terms of manpower, we are during that time we are not able to cope. But luckily, KKM is sending more manpower to help us, and also in terms of a number of nurses also quite short because sometimes nurses also need to be quarantined either because they are unwell or they have contact with COVID-19 patient. By the end of my attachment, I think I do manage about almost 20 patients of COVID-19 who are critically ill in our ICU. I was quite scared because working in ICU, COVID itself, we do see a lot of critically ill and severe COVID patients. So as a healthcare workers, I'm quite concerned if I got the COVID, would I become bad like this kind of patients? If the numbers of COVID cases still going up, I'm afraid our healthcare system is not being able to cope anymore. I'm afraid sooner or later we might become a country like Italy, where patients are left to die in the street because there are not enough doctors and nurses and healthcare to cope for this patient. As a person, even if you do not get severe COVID, but you might infect your families, probably your parents or your young kids, and sometimes they can die because of the COVID. So I strongly advise the people to follow SOPs and not to go out unnecessarily.
Perikatan Nasional leaders were given a briefing about the emergency ordinance and its management, as well as the COVID-19 management and vaccination plan at the Perikatan Nasional Presidential Council meeting that took place yesterday.
Prime Minister Muhyiddin Yassin said the leaders of parties in the Perikatan Nasional Government are satisfied with the explanations and in-depth discussions on the emergency ordinance. He said this after chairing the PN Presidential Council meeting yesterday. Muhyiddin, who shared several photographs of the meeting, said the Chief Secretary to the government, Muhammad Zuki Ali, and Health Ministry Deputy Director General, Dr Nurhizan Ismail, had briefed the leaders on the emergency. In a Facebook post, he said the 2-hour meeting also discussed the COVID-19 vaccination plan. He added that the Presidential Council will continue to be the platform for high-level discussions for all political parties in the PN government to ensure political stability, smooth governance, and to guarantee the safety and well-being of the people and country. However, the presence of top civil servants during the meeting of party leaders from the Perikatan Nasional Plus government has sparked questions from opposition MPs. Taking to Twitter, Tanjung Malim MP Chang Lih Kang pointed out that the meeting was a political one and was attended by the Chief Secretary to the government. Meanwhile, Segambut MP Hanayo said the practice was unprofessional. The meeting included the top leaders from UMNO, PAS, PBB, MCA, MIC, PRS, SUPP, PDP, PBS, STAR, and SAPP. Muhyiddin, who is also the Bersatu president, represented his party.
Kedah Menteri Besar Muhammad Sanusi Muhammad Noor commented on a warning by MIC President S.A. Vigneswaran that MIC would not arbitrarily support him in GE15 for the sake of political interests.
Kedah Menteri Besar Muhammad Sanusi Noor said he will not entertain any statement from MIC leaders, including the party's warning that it will not support him in the 15th general election. Sanusi said that in the last general election, the party also did not support PAS. Most of them voted for Harapan. That's why MIC was left with only one seat. The fact is that MIC needs votes from non-Indians, he told Berita Harian. He said this in response to a statement by MIC President S.A. Vigneswaran, who described him as an inexperienced leader that did not have the ability to socialize with other races. Following that, Vigneswaran warned that the MIC would not arbitrarily support Sanusi in GE15 for the sake of political interests. Over the past week, Sanusi has been involved in a war of words with several MIC leaders. This was following his announcement that Kedah would not recognize Thaipusam as a public holiday this year due to the COVID-19 situation. The decision to nix the holiday has courted flack from MIC, Harapan, and even former UMNO President Najib Abdul Razak. In response to the criticism, Sanusi said the move was not meant to sideline Hindus and that MIC should lobby the federal government to make it a national holiday.
And that's a wrap for this evening. For more stories, go to KiniTV.com. Don't forget you can follow us on Instagram, Twitter, YouTube and Facebook to get the latest headlines because we post them there too. Remember to wear your mask if you're heading out and if possible, stay at home. Let's weather this storm together. I'm Daniel Anthony. Thank you for watching and as always, stay safe Malaysia.